While we still haven't discovered the cure for male pattern baldness, there are treatment options today to help stop and even reverse hair loss in its entirety. However, that doesn't help men who have already lost a majority of their hair and are looking for quick results. Depending on how invasive you want to go, there are surgical procedures available. So keep watching if you're looking for fast results, because we're covering the best hair loss treatments today. Hair transplant surgery. Hair transplant is a surgical procedure that involves moving existing hair to regions where hair is non-existent. There are two types of hair transplant surgeries that are available. Follicular unit strip surgery, or FUS, involves removing a small strip, roughly 6 to 10 inches in length, from the back of the head. This is then sewn shut, hiding it between existing hair. That strip is divided into as many as 200 separate grafts. How many grafts you can get all depends on your hair type and what's needed. There's also follicular unit extraction, or FUE. This involves removing follicles from the back of the scalp. Small dots replace the areas where follicles were removed as they heal over time. Then, those are grafted in the proper areas that require healthy follicles. Each follicle is transplanted into the area that requires it in a painstaking procedure that lasts roughly 4 to 8 hours. For both types of surgeries, you can expect to return to work and be normal in a few days. However, hair growth begins relatively quickly after it falls out. To quicken the pace, doctors often prescribe minoxidil to help speed up the pace of that growth. Testosterone therapies. One of the prevailing thoughts amongst the scientific community is that there's an association of high testosterone levels with hair loss. However, this isn't the standard free testosterone that roams your system. Rather, this is the DHT, which is converted from testosterone and what causes hair follicles to shrink. Since your hair follicles are very sensitive to the presence of DHT, a high level of DHT in your body can cause sudden losses of hair over short periods. However, male pattern baldness is not associated with the actual levels of DHT in your body. It has more to do with the actual sensitivity of your hair follicles to those levels. The drugs that interfere with testosterone levels are minoxidil or Rogaine, finasteride or Propecia, dutasteride or Avodart, and others. Minoxidil is quite possibly the most popular hormone therapy-related hair loss treatment option in the country. It helps to prevent testosterone from converting into DHT, the hormone that causes hair follicles to shrink and disappear over time. Laser treatment. Low-level laser therapy is another treatment option for hair loss. Laser treatments are used to irradiate photons into the tissues of the scalp. When the photons are irradiated into the scalp, it promotes hair growth by absorbing into weaker stem cells and follicles. However, this treatment is 50-50 for people. It sometimes works and sometimes doesn't. Despite that, studies have indicated that this type of therapy for hair loss is safe and it is somewhat effective. One of the best parts of laser treatment options is that they're non-invasive. Unlike surgical procedures, they're also not painful. To see any real results, it's incredibly time-intensive, requiring you to sit through numerous sessions every single week. And this often extends over many months of doing so. Plus, laser treatments are costly, running you upwards of several thousands of dollars every single year. Since the results can vary based on each individual, there's no uniformity or guarantee that laser therapy is going to work for you. Still, that certainly doesn't stop people from experimenting with it. PRP therapy. PRP stands for platelet-rich plasma. Blood is first drawn from the patient. Afterward, that blood is placed into a centrifuge that spins it at a high rate of speed, separating the fluids based on their densities. Then, it's processed and injected back into the patient through the scalp. The idea is, by increasing blood flow to the hair follicles, it also works to promote stronger hair. Oftentimes, this type of therapy is combined with testosterone therapies such as minoxidil and finasteride. Ultimately, not enough research exists to prove whether or not PRP therapy is highly effective. The therapy lasts roughly 4 to 6 weeks, with a maintenance period afterward that runs roughly 4 to 6 months. Pricing for PRP therapy really depends on where you live. For the most part, expect to pay roughly $400 to $1,000 per session, making it a more costly treatment option for your hair loss. As you can see, there are quite a few options for stopping and even reversing hair loss. Whether you want to treat it through invasive or non-invasive procedures is up to you. We encourage you to do your research about each before you begin treatment, as they can get costly. And before you go, if you liked this video, be sure to like, comment, and subscribe.